Warning: these 8 medications could trigger a heart attack. Did you know that in the United States, someone has a heart attack every 40 seconds? It's a staggering statistic, but what's even more alarming is that certain medications we take daily for unrelated health conditions could be quietly raising our risk of cardiovascular events. While these drugs serve important medical purposes, scientific research has linked some of them to an increased likelihood of heart attacks. Understanding these risks is crucial for making informed healthcare decisions. Today, we're exploring 8 common medications that may negatively impact heart health and what you can do to protect yourself. Let's dive in. This video is for educational purposes only and is not a substitute for professional medical advice. If you are unsure about your condition, please consult a healthcare professional or contact emergency services. All information presented has been thoroughly researched and verified. You can find source links in the video description. 1. NSAIDs. NSAIDs, non-steroidal anti-inflammatory drugs, such as ibuprofen, Advil, Motrin, and naproxen, Aleve, are household staples, relied upon for everything from headaches to chronic pain relief. While they effectively reduce inflammation and provide fast pain relief, research has revealed serious cardiovascular risks associated with their use, especially for individuals with high blood pressure, heart disease, or a history of heart attacks. A 2017 study in the British Medical Journal found that even 1 week of NSAID use can increase heart attack risk by 20% to 50%, depending on dosage and frequency. These drugs work by blocking prostaglandins, hormone-like compounds that help regulate blood pressure, kidney function, and vascular health. By interfering with these natural processes, NSAIDs can lead to narrowed blood vessels, elevated blood pressure, fluid retention, and increased blood clot formation, all of which can significantly raise the likelihood of heart attacks, strokes, and other cardiovascular events. The dangers are especially pronounced for those who take NSAIDs at high doses or for extended periods. Even short-term use in otherwise healthy individuals has been linked to increased cardiovascular strain. Given these findings, many doctors now caution against long-term NSAID use, particularly for those with pre-existing heart conditions. Instead of NSAIDs, safer pain relief options include acetaminophen, Tylenol, physical therapy, or natural anti-inflammatory remedies like turmeric, ginger, and omega-3 supplements. Lifestyle changes such as regular exercise, a heart-healthy diet, and stress management can also reduce the need for frequent pain medication. For chronic pain sufferers, working with a healthcare provider to explore personalized pain management strategies is essential. The widespread availability of NSAIDs can create a false sense of security, but these medications are far from harmless. If you rely on NSAIDs regularly, talk to your doctor about alternative treatments to protect your heart health. Pain relief shouldn't come at the cost of your cardiovascular well-being. 2. Diabetes medications. People with diabetes have a significantly higher risk of heart disease, with 68% of diabetics over 65 dying from cardiovascular complications. However, recent research suggests that some type 2 diabetes medications further increase the likelihood of heart failure. In April 2016, the FDA warned that medications containing saxagliptin or alogliptin, commonly prescribed for type 2 diabetes, may elevate heart failure risk, particularly in patients with pre-existing heart or kidney disease. These drugs lower blood sugar by preventing the breakdown of hormones that stimulate insulin production. While both medications carry warnings, studies indicate saxagliptin poses the greater danger. Since heart disease remains the leading cause of death worldwide, patients should be cautious about diabetes medications that contribute to heart failure. Safer alternatives may include sulfonylureas, diabinase, Amaryl, biguanides, metformin, and meglitinides, Prandon, Starlix. However, thiazolidinediones, Avandia, Actos, also heighten heart failure risk, and Farxiga has been linked to bladder cancer. Always consult your doctor to find the safest treatment. 3. Testosterone and anabolic steroids. Testosterone therapy and anabolic steroids are often used to enhance muscle growth, boost performance, or address medical conditions like low testosterone, hypogonadism. However, their impact on heart health is a growing concern. A major study in JAMA Internal Medicine found that men who started testosterone therapy had a 30% higher risk of heart attacks, strokes, and blood clots compared to non-users. The risks were even greater for older men and those with pre-existing heart conditions. Testosterone and anabolic steroids stimulate red blood cell production, increasing blood viscosity, thickness. This raises the likelihood of blood clots, heart attacks, and strokes. These substances also lower good HDL cholesterol and raise bad LDL cholesterol, promoting plaque buildup in arteries and increasing the risk of atherosclerosis. Additionally, anabolic steroid abuse can lead to high blood pressure, irregular heartbeats, and even sudden cardiac events. Despite the risks, testosterone therapy remains a medically necessary treatment for some men, particularly those with clinically diagnosed low testosterone. However, it should only be used under strict medical supervision with regular cardiovascular monitoring. Blood tests to check cholesterol, red blood cell count, and heart function are critical in reducing potential complications. 4. Some antidepressants, SSRIs and SNRIs. Selective serotonin reuptake inhibitors, SSRIs, and serotonin norepinephrine reuptake inhibitors, SNRIs, have revolutionized the treatment of depression and anxiety, providing relief to millions worldwide. Medications such as fluoxetine, Prozac, sertraline, Zoloft, and venlafaxine Effexor are widely prescribed due to their effectiveness in stabilizing mood and reducing symptoms of mental health disorders. However, growing research suggests these drugs may have unintended effects on heart health. A study published highlights how SSRIs and SNRIs can impact cardiovascular function. Since serotonin plays a role in both brain chemistry and blood clotting, these drugs may alter platelet function, increasing the risk of excessive bleeding. Additionally, they can affect heart rhythm, potentially triggering arrhythmias in patients with pre-existing heart conditions. Some research also links long-term antidepressant use to a slight increase in blood pressure. Despite these concerns, untreated depression itself is a major risk factor for heart disease, meaning the benefits of treatment often outweigh potential cardiovascular risks. Patients with heart conditions should discuss their options with a healthcare provider before starting or discontinuing antidepressants. Doctors may recommend regular monitoring, lifestyle modifications, or alternative medications based on individual risk factors. Most importantly, antidepressants should never be stopped abruptly, as this can lead to withdrawal symptoms, mood instability, or even relapse. A supervised tapering plan ensures safe medication adjustments while maintaining mental well-being. 5. Decongestants, pseudoephedrine and phenylephrine. When congestion strikes, many people reach for over-the-counter decongestants like pseudoephedrine, Sudafed, or phenylephrine, which are found in popular cold and flu medications. While these drugs provide quick relief by shrinking swollen nasal passages, their effects go far beyond the nose. Decongestants work by constricting blood vessels throughout the body, which can significantly impact heart health, especially for individuals with high blood pressure, heart disease, or other cardiovascular risk factors. Research published in the American Journal of Medicine warns that pseudoephedrine can increase blood pressure, heart rate, and the risk of heart attacks and strokes. The dangers are even greater when combined with caffeine, smoking, or certain medications. These effects make decongestants particularly risky for individuals with hypertension or arrhythmias, who may experience sudden spikes in blood pressure or irregular heart rhythms. Because of these risks, many doctors now recommend alternative treatments for congestion relief, especially for those with existing heart conditions. Safer options include saline nasal sprays, steam inhalation, humidifiers, or natural remedies like honey and ginger tea. Antihistamines, such as loratadine, Claritin, or cetirizine Zyrtec, can also help relieve congestion in cases of allergies without the cardiovascular side effects. If you have a history of high blood pressure or heart disease, it's crucial to read labels carefully before using any cold or flu medication. Many combination decongestants also contain NSAIDs, caffeine, or other stimulants that can further elevate cardiovascular risk. Always consult your doctor or pharmacist to ensure that the medication you're taking is safe for your heart. Cold and flu relief shouldn't come at the expense of your cardiovascular health. If you're at risk, opt for safer alternatives to keep your sinuses clear without putting your heart in danger. 6. Calcium channel blockers. Calcium channel blockers, CCBs, are among the most commonly prescribed medications for high blood pressure and angina. Drugs like amlodipine, Norvasc, diltiazem, and verapamil work by relaxing blood vessels and reducing the heart's workload, effectively lowering blood pressure. However, recent studies suggest that certain CCBs, particularly short-acting dihydropyridines, may increase the risk of heart attacks by up to 25%. The reason behind this risk lies in how CCBs affect the cardiovascular system. While they improve blood flow, they can also trigger compensatory mechanisms such as fluid retention, activation of the sympathetic nervous system, and fluctuations in blood pressure. These effects may lead to swelling, dizziness, and even worsening heart failure symptoms, particularly in patients with pre-existing heart conditions. To minimize risks, doctors now favor longer-acting CCB formulations or alternative treatments like ACE inhibitors, ARBs, or beta blockers. Patients should monitor for side effects such as ankle swelling, fatigue, or irregular heartbeat and consult their doctor for safer medication options. 7. Chemotherapy and heart risks. Some chemotherapy drugs, especially anthracyclines, like doxorubicin and fluorouracil, 5-FU, can harm heart health, increasing the risk of heart failure, arrhythmias, and heart attacks. Up to 26% of patients on doxorubicin may develop heart complications, particularly at higher doses. These drugs generate free radicals, causing oxidative stress and heart damage over time. Oncologists monitor heart function with echocardiograms and MRIs, sometimes prescribing cardioprotective medications. Patients should maintain a heart-healthy lifestyle, including exercise, a balanced diet, and avoiding smoking or excess alcohol. Any signs of heart issues, like chest pain or fatigue, should be reported immediately. 8. Heartburn medications and heart risks. Proton pump inhibitors, PPIs, like omeprazole, Prilosec, and esomeprazole Nexium, effectively treat heartburn and GERD, but long-term use may increase cardiovascular risks. A Stanford University study found PPI users had a 16 to 21% higher risk of heart attacks, possibly due to reduced nitric oxide, which helps keep blood vessels flexible. PPIs may also lead to magnesium deficiency, irregular heart rhythms, and kidney disease. Safer options include H2 blockers, famotidine, and lifestyle changes like avoiding trigger foods and maintaining a healthy weight. Long-term PPI use should be monitored by a doctor to balance benefits and potential risks. Thanks for watching. Don't forget to subscribe and stay tuned for our next video. See you soon.